Welcome to one of our simulation rooms. My name is Leah Greene and I'm a senior lecturer in simulation-based education. Today I'm going to take you on a tour of our simulation room. There are two rooms almost identical, they're just mirror images of each other. As you can see, the room today is set up like a clinical environment. We don't always expect it to be set up in this way. We can change the environment. Sometimes you might find it set up as a living room or a doctor's waiting room, basically anything that you can imagine. So the room is set up like a clinical environment, and this is how you will find the room most times that you enter into the space. The rooms themselves have cameras built into the ceiling and the walls, and microphones, as you can see, dangling down from cables. We use the cameras for two purposes. One is to live stream, and the second is to record the scenarios. When we live stream, you will find there will be a small group of students working through the scenario in the sim lab itself, and another group of students will be observing the action as it takes place live through the cameras. Now, when you're observing, it's not a point where you sit down with your feet up drinking a cup of tea. No, it's an active participatory role. You'll be asking questions and involved in the scenario, vicariously observing your peers as they work through the scenario. When we record the scenarios, obviously we only record with your consent, and we only use those recordings for teaching and learning purposes. And again, it's quite awkward sometimes thinking of hearing your voice back on a recording, but it's extremely useful, and we would use that footage to offer it back to you so that you can watch yourselves as you've participated in the scenario and reflect on your actions. After every single scenario, we perform a debrief, where again you can watch yourselves back if we've recorded, but also you're given the opportunity to ask any questions, reflect on what happened, and move forward with an action plan to take into practice of any things that perhaps didn't go as well as you would have liked them to. Other things in the room, there are sinks available. As you can see, we have running water. We have hand gel, soap, sharp bin, paper towels, aprons, and rubber gloves. If you would ordinarily wash your hands prior to going in to see a patient, then obviously I would recommend that you would do that during the scenario. If you'd like more information, please click on the hotspot. On the totem, we have oxygen and we have suction and a working nurse call system, and as you can see, the patient monitor. Again, please click on the hotspot for more information about the totem. If we have a look at this in more detail, the nurse call system, you can leave this buzzer with your patient, and in case of an emergency, you can press the emergency buzzer. There is a reset button at the bottom, the green button here, when you want to reset that alarm. The oxygen is switched on like this. As you can hear, that is simulated oxygen. And the suction is switched on using the lever at the side and adjusted in this way. Patient monitor, as we can see, at the moment we have the patient's heart rate, saturations, the manual blood pressure and the temperature. Remember that information will be presented to you throughout the scenario using the patient monitor. Equipment and props and everything that you need will be available to you, as you can see, in the scenario. But if you find that something is missing, there will always be a facilitator here present who will be able to get you any additional information, any additional equipment. If you find that maybe you need some extra pillows or a blanket, they will be able to go and get you anything that you find is missing. Please do feel free to touch everything that is in here. It's here for you to interact with and for your needs during this scenario. So don't feel that you can't touch and interact with anything. Other things to note, we have a monitor on the wall here, and that's used for giving you additional information during the scenario. So things like x-rays, blood test results, ECGs, anything additional, we will send through on this monitor. Again, your facilitator will guide you through that during the scenario. And for additional information, please again click on the hotspot. There's also a telephone. It's the easiest phone in the world to use. There's one button to press, Now don't be surprised when you use the telephone, there will be a real person at the end of the line, so please do have a conversation with them during your scenario. If you need any help during the scenario, if you need to ring through for a doctor, a consultant, a patient review, ring through to x-ray, please use the telephone. Oh hi, I'm just calling from the simulation laboratory. I'm calling regarding our patient, Mr. Butler. I was just wondering if you'd be able to come and see him. He's not feeling so well at the moment. That would be wonderful. Thank you for your help. I'll see you soon. Bye-bye now. So at the moment we have one of our mannequin patients in the bed, but don't again be surprised if you come into the scenario and find a real person in the bed. We work with both real people and mannequin patients. And my advice to you would be to treat all the patients in the bed, whether a patient, a real person or a mannequin, as a real person, because you will get an awful lot out of the scenario. Although they don't look very realistic, they are extremely realistic, and all the parameters can be changed during the scenario, so they are very responsive to your actions. So we have one of our mannequins here, and as you will see, he will be able to talk and respond to you if you speak to him. So, Mr. Butler, how are you feeling?
Not too bad. I'm not feeling well.
Well, I've just called through to the doctor and they are on the way to come and see you. I know you're not feeling 100% at the moment.
No.
But they are on the way and I'm here if you need me, okay?
Okay, thank you.
So, the patients, like I said, are very responsive. So if you ask them a question, unless they're unconscious, they will respond and give you additional information that you might require during the scenario. I'm sorry, I'm just taking your pulse here, Mr. Butler. Is that okay?
Yeah, that's alright, yeah.
So the patients have pulses in all the right places. So if you want to take the pulse, you can find it here. And there is a clock on the wall. If you don't have your fob watch, you can use the clock on the wall there. And obviously the pulse can be changed, it can be increased and decreased. So we've got pulses in the wrist, the elbow. Now the femoral pulses are quite difficult to find. So if I show you now, they're located here. And they're really important during the scenario. If you need to find a central pulse, this will be the location that you will go to. Also got pulses behind the knee, on the top of the foot, and behind the ankle. I'm sorry, Mr. Butler, we're all done now. I'll just tuck you back in. Obviously, remember the patient's dignity at all times. There you go. Is that better?
Yeah, thank you.
So our simulated patients also have a respiration rate, so you can take that. You can see the chest is rising and falling, and again, that can be changed. And you will be able to see that he's blinking. Now the only other movements that the patient will make are that he can have seizures if the computer tells him to do so. Other than that, he can't sit up by himself, he can't move around, he can't walk. He will simply stay in the position that you've placed him or the position that you find him. So if you find him sat in a chair or laid on the floor, I would strongly recommend that you leave them there, because they are very heavy and all the weight is in the top half of the body. We use hoists when we're moving them around, so please don't try to move them. Use the bed controls if you need to sit them up or lay them down. They also have reactive pupils, so if you use a pen torch, you'll be able to see this. Mr. Butler, I'm just going to shine a torch into your eye, is that okay?
Yeah, that's alright.
Okay. So I can see his pupils are responding to the light. Again, we can change that and we can make his pupils non-responsive, and we can also make the pupils change in size, and that might be really important during your scenario, so always remember to check the pupils. Obviously the mannequins are breathing and talking, but they also have additional sounds. They have chest sounds, heart sounds and bowel sounds, and these again can all be changed if the scenario requires it. The only other thing that leaves me to show you is the control room, and just to repeat that this is a control room, it's not an observation room. We do not use simulation for assessment purposes. While you're in the scenario, you will enter into the scenario, at the level that you are at. So if you're a student nurse in your second year, you will come into the scenario as a second year. You will never be expected to open into a role as a consultant or an anaesthetist because it wouldn't be realistic and we wouldn't expect you to do that. So you'll enter into the scenarios at the level that you're at, and you will participate in scenarios that have been designed for you and your requirements with the learning objectives that you can achieve. Again, there is always a facilitator present who will guide you through. They may be sat at the desk busy, but they are there to help you, so don't be afraid to ask them for additional help. You will work in small groups and you'll be able to help each other out as well. It's not a test, it's not an assessment, there's nobody observing you. So help each other out, work as a team. So if we look into the control room, if I pop the lights out now, you'll be able to see into the control room. That just leaves me time now to remind you to click on the additional hotspots for more information about the different sections of the room, and we look forward to welcoming you up in the simulation laboratory where you'll be able to have another proper look round. Thank you.